Okie dokie, being live streamed. Awesome.
Okay, you are live on YouTube.
Okay, then we're going to call the meeting to order for the month of June for both Warren and Washington County Community Services Boards. Let's go ahead and start with introductions. When I call your name, please unmute yourself and share who you are and who you're representing. And we'll go from there. I'll start. I'm Kim Brayton. I'm here representing Warren County. I'll go ahead according to how you guys show up on my screen. So there's no preference here. Belinda is the first person that I see.
Belinda Bradley, Community Services Board, Warren County.
Next I see is Cindy.
Cindy Wasson, Warren County.
And we have Holly.
Holly Irian, Warren County.
Next on my screen is Rob. Rob, you want to do everybody that's in the room there with you?
Yep, sure. Here in the room with me, we have
Hi, Mary Murphy, Washington County.
Mary.
just Mary and myself, Rob York, Director of Community Services, Warren and Washington County.
That's some pretty good social distancing then, you guys. Just gotta say. All right, the next one I have on my screen is Nicholas.
Nicholas Patalfimov from ACCA. How are you?
Great, thank you for joining us, Nicholas. Next, I have Sue Mowry.
Sue Morey, Washington County.
Hi, Sue, thank you for joining us. And then next I have Adele Potter.
Yes, Adele Potter, Washington County Community Service Board member.
Hi, Adele.
Hi.
Next is Amy.
Amy Malloy, Warren County Community Services Board.
Hi, Amy, it's good to see you. Diane is next.
Hello, I'm Diane Ham. I'm from the Office of Mental Health, Hudson River Field Office. Hi.
Hi, thank you for joining us.
Thank you.
Next, we got Susan McManus.
Hi, I'm Sue McManus from Warren County Community Services Board.
Hi, Sue. And Crystal.
Hi, Crystal Mallory, Office of Community Services Secretary.
Hi, Crystal. Then we have Harry.
Carlson, Office of Community Services.
Jason.
Hi, Jason McLaughlin, Executive Director at Wade House.
Thank you for joining us. And we have Christian. Oops, I had Christian. Did I lose him? I think he might have dropped off. All right, then we'll go to the next one. I have Jennifer.
Good afternoon, everyone. Jennifer Neifeld, CEO of 820 River Street.
Oh, great. Thank you for joining us. Okay, next I have Amanda.
Good afternoon, Amanda West, Executive Director of the Council for Prevention.
Hi, Amanda. And then I have Linda Wright.
Hi, Linda Wright, Child and Youth Vote Coordinator and Systems of Care Coordinator for Washington County with the Office of Community Services.
Hi. Adrian.
Hi, Adrian Slico, Director of Crisis Services at Northern Rivers.
Hi, Adrian. Thank you for joining us. And we got Amy Secor. Sorry, there's a couple Amy's.
Amy Secor, Warren County Probation.
And then we have Kristen Hardy.
Hi, Kristen Hardy, Lieutenant for Washington County Sheriff's Office and the Washington County Board.
Thank you for joining us. Jennifer Hill.
Hi. Oops. Sorry, computer difficulties. Jennifer Hill, Behavioral Health Services North.
Excellent. Hi. Mary.
Mary McLaughlin, AHI, Director of North Country Care Coordination Collaborative.
Hi, Mary. Next, we have Maureen Mitchell.
Hi, Maureen Mitchell from OPWDD.
Great. Thank you for joining us. Christian's back now. Christian.
Chris Hanchett, Warren County Department of Social Services Commissioner.
Great. Thanks, Chris. And Lisa Kutu.
Hi, everyone. Lisa Kutu, Deputy Director Clinical for the Office of Community Services.
Next, I have Dylan.
Dylan Swartner, Warren County Public Defender's Office.
Excellent. Thank you for joining us. Paige?
Hi, this is Paige Lorette, team lead for the ACT team with Northern Rivers for Warren, Washington, and Saratoga counties.
Okay. Next is Jolene.
Hi, this is Jolene Darby, COO at People USA.
Then we have another Linda. I don't have the last name on it, and I don't see a picture or image. You did have a Linda? Might have lost her. Okay. And then Heather. Heather's here.
Hi, Heather Adams, Wendell, Washington County. Sorry.
Excellent. Is there anybody that I missed? Sometimes the pictures switch around. Anybody that didn't get a chance to introduce themselves? Okay, excellent. Thank you all for joining us today. Rob, if it's okay, we'll go ahead and just go into the agenda items. The first one is approval of minutes for May 12th for the Community Services Board. Let's see. So do we have the quorums now for both counties, right? Okay, I thought they rolled in. Okay, so then we'll go ahead and start with Warren County. Hopefully everybody received the minutes from the last meeting and was able to take a look at it to identify whether or not there needed to be any changes. Was there any discussion? Anybody see anything that needed to be changed in the minutes?
Yes, I did, please. Just to keep on the radar this idea that we were going to talk about children's services in our counties at one point, and it was a last minute blurb that we had that I think got missed in the minutes. But I just wanted to keep that on the radar, that Robert suggested that we talk about that down the road and maybe devote some time to it at one of our board meetings, just with so many kids being in crisis and looking at the opportunities for services there.
Great. Yes. Crystal, can you make note of that edit needing to be made to the minutes?
Yes, ma'am.
Excellent. Any other edits or things anybody saw or noticed? If not, then could I have a motion in Warren County to accept the minutes with that edit?
So moved.
And Cindy second. All in favor, show raise of hands, please. For Warren County. Okay, any opposed? Carried for Warren County. Thank you. Heather, I'll hand it over to you for Washington.
Thank you. Can I have approval for the minutes for May 12th, Community Service Board meeting for Washington County? Does anyone have any discussion from Washington County concerning the meeting minutes? No. Is there a motion?
I'll make a motion.
Okay, thank you. Is there a second motion?
Adele Potterkin, second.
Okay, thank you. All in favor, say aye.
Aye.
Any opposed? Okay, thank you. Any opposed? Any abstentions? Motion carries for Washington County.
Okay, I'm attempting to do a screen share here for the first item. I don't know if it's coming through yet.
Yeah. Sir. It's there.
All right, so the first item here that we have on new business is a Warren County only item. As folks are aware, as we discussed in previous meeting, we were going to establish an ad hoc committee of the Community Services Board to serve in the purpose of reviewing ARPA, American Rescue Plan Act fund proposals that are specifically designated for behavioral health purposes. Warren County made a determination to set aside a block of $1 million that would be assigned to the Community Services Board for solicitation of projects and selection of projects for to address those areas related to behavioral health. So I had sent something out or had mentioned it at the last meeting, I guess, and people had a number of people had volunteered. So we had 5 volunteers. But before we vote to approve the ad hoc committee, I'd like a little bit of discussion. There was a decision point about the number of committee members that we need to make. If we have 5 members of our ad hoc committee, then that constitutes a quorum of the board. So what it does is it means that we're really having a full board meeting at each time the ad hoc committee meets. Now, I don't really see that as a problem. I mean, anybody that wants to attend any meeting is welcome to anyway. If the other board members wanted to attend, they could attend whether it was just 4 members or 5. They're still open meetings, so it's still open to the public either way. We still have to notice them and follow all the open meetings laws. It's just whether it's considered to be a full board meeting when you have 5 members present. So we would be really authorizing, additional full board meetings for Warren County, even though, the business of the meeting would be the focus, would be the ad hoc committee's business. So I guess with all that said, I just felt like, why don't we just go ahead then and treat it like a full board meeting? It would be Warren County only. And, of course, anybody who wants to attend could attend, just like any other meeting. We probably would share the materials with everyone, even though, only the members who are on the ad hoc committee would be meeting and reviewing and doing the business, making the selections and recommendations for selections back to the full board. Anybody have thoughts on a better way to go with that and 5 versus?
Well, Rob, you could take me off if you want to have it 4. If it's easier for, rather than having a full board meeting. That's fine with me.
Are there any downsides for it to be the full board meeting?
The downsides seem to be that you have to treat it like a full board meeting in the sense that you notice it as a board meeting and you supply all materials to all the members.
Crystal, can we have some support with that to be able to send the materials and things like that and make those announcements? Because I mean, it's great that everybody wants to participate. The number 2.
Yeah, so last year when we did these meetings, I think we did do minutes and put them out as well.
Okay. And you would be available to, we'll make sure it's a time that you can be available if you'd be willing to participate in it.
Oh, absolutely.
Okay.
I'm good.
So I would think for today's purposes, we could go ahead and approve the members as the ad hoc committee. And then, if we make a determination that we want to reduce it to 4, we can just do that at a future meeting. I mean, the ARPA funds are going to be, it's going to be a process where we solicit proposals. So, nothing's going to come in probably in addition to what's already come in, nothing, I think we have some time, in other words, I think, if we decide we want to tweak it as we go along.
Okay. Yeah. And if for some reason one of the 5 aren't able to do it, then we make the adjustments at that point in time.
Yeah. Okay. And I think what I would do once we appoint the members is we will work on getting an initial organizing meeting together rather quickly.
Okay. So we can doodle poll that for the 5 and figure out what's going on Okay.
Yeah.
That sounds like a good plan, Rob. Any other thoughts from anybody else in Warren County or in this group?
I agree. It does sound like a good plan. It's got some flexibility too, so.
Yeah. Okay. Then we need to go ahead and vote on the slate for the ad hoc committee.
Yeah, I think we need to vote, Warren County needs to vote to approve those, appoint those members to the ad hoc committee.
Do I have anybody from Warren County willing to make a motion to do so?
I'll make that motion.
Excellent. Thank you, Chris. Do I have a
You're
second?
welcome.
I'll second. This is Amy.
Hi, Amy. Thank you. All in favor? Can I get a raise of hands just so we have the visual of it? I think it's easier to do. We scroll down all the pictures. Okay. Any opposed? I don't see anybody opposed either. If I'm missing somebody, just holler at me. Okay, no. Okay, so then motion carried.
Okay, thank you. So our next item of business is a little bit of sadness, I think, at least from my perspective. Maybe bittersweet because I certainly wish Amy well in her future plans. But we have a Warren County Community Services Board resignation from Amy Malloy. And I don't think I sent this out as part of a packet, but we did receive correspondence from Amy, and I'll just read that. Dear Mr. York, it is with sincere regret that I must inform you of my resignation from the Warren County Community Services Board, effective July 30th, 2022, in anticipation of a relocation to Texas. It has been a privilege to serve the Warren County community for the past 6+ years. I am grateful for the opportunity to support the local organizations that deliver important mental health and substance use services to individuals and families. It has been an incredible and humbling experience. Thank you. With warm regards, Amy Malloy. So, Amy, I don't know, do you want to be put on the spot here? Anything you want to say? We're sorry to see you going.
Yeah, I'm not sure if I'm ready. I think that kind of says it all. It has been really great. This is a move that I've been anticipating for a few months, so I've had a chance to sort of adjust to it. Still have family here, so we'll be back a lot, but my husband has been working overseas, but they've called him back to Houston, so we are heading back at like the worst time of year.
That's a double whammy because we're going to lose you off the board and we're losing you out of the area. You've been so invaluable to so many agencies and things that you've done up here. We're really going to miss you.
Thank you. Thank you very much. This will always be a special place for us, for me.
Yeah, you've been a big help to me and a great service to the community, Amy.
Thank you. I'll see you next month.
And I do appreciate the advance notice. So if you picked up on it when I was reading, effective July 30th. So that gives us a little time to line up another member. Tammy Delorme had a suggestion for me, an individual who lives in Warren County. And so I'm following up with that person. Sounds very promising. So Kim, I guess we need to vote to accept Amy's resignation from the board.
And if we don't accept it, what happens? I'm teasing. Does anybody in Warren County want to make that motion to accept her resignation? Cindy, do I have a second?
I'll second that.
Thank you, Chris.
You're welcome.
Great sadness. Do I have all in favor of accepting the resignation? Can you please have a show of hands? I'm looking at the second page here. Okay. Any opposed? We're all kind of opposed, but we're gonna do that. Okay. Unfortunately, we have to accept that resignation. So motion passed.
Thank you.
Good luck. Good luck, Amy. We're really
Thanks
going to
so
miss
much.
you.
Thank you again, Amy, for your years of service.
Thank you. I'll see you all next month.
Yes. Okay, next item on our agenda is youth respite provider contracts. And I think Linda Wright is on, so she's going to help me out with this a little bit. But currently, we, the Community Services Board in Warren County, this funding flows through Warren County only, although the services are available to both counties. This pot of respite funding is something that the Hudson River Field Office of the Office of Mental Health helped us secure a number of years ago to help develop respite services for children and youth in our community. And we were able to secure $59,396 for this purpose. And so what we did at the time is we developed these contracts with White House, Northeast Parent and Child Society, Captain Community Human Services, and Vanderheiden. And what you'll see is that the Community Human Services is $16,000 as needed, and Vanderheiden is $16,000 as needed. So that you'll notice that just the White House amount, the Northern Rivers amount, and then the 16,000 adds up to the 59,396. So in other words, that 16 is one pool, and sometimes Vanderheiden's drawing from it, and sometimes Captain is drawing from it.
Rob, can you advance your screen? I don't think anybody sees what you're talking about.
Oh, really? Well, it says I'm screen sharing. I don't understand.
Still the Warren County Committee.
Yeah, we're just looking at kind of the regular view, not the slide show.
Yeah, it is
Hit-
screen
hit
sharing,
slide
but
3
the
and I'll show
slides
up.
aren't advancing.
Yep, slide 3.
What slide are you seeing now?
We only see one. We need to go to slide 3.
The first slide that you had shown is still there.
It's probably just sharing a different screen than you think.
Oh, okay, wait a minute. That's a good point. Let me see if I can fix that. Sorry, bear with me a minute here.
He had
it for a minute.
Yeah, second. There you go.
Now you getting it?
Yeah.
All right, sorry about that, folks. So this is the current state of our respite funding. You can see we have the 4 agencies. What I was trying to explain was that Captain and Vanderheiden draw off of the same pool of 16,000, sort of as needed. What we would like to propose is adding 2 new agencies to this list. And what we're going to try to work out at the county is to really put these all in one pool. We may end up leaving White House, I think, at the current amount, but we're thinking that the others we want in one pool where we can draw from it as needed, because we were running into issues where, you know, a certain agency didn't have enough funding in their contract, and then another one had, you know, couldn't provide the services, but we had extra funding in their contract. So we were running into those kind of issues. So we'd like to make most of these. If I think Linda, you'll have to help me out on this, but I think we're keeping White House at the same amount.
Well, White House we were keeping White House's crisis respite as the same amount. They would be coming into this pool to do hourly respite. They've been in their contract. They do have hourly respite, but we did not extend funding to them for the hourly. So we were tying it all under the crisis. But this would completely be, White House would keep the 34 3 for crisis respite. So that way we'd be able to do crisis respite with the 2-bed availability, as well as to be able to offer hourly respite. So when youth are kind of struggling and might need a couple hours away from the home, they can go to a White House and we can actually be able to fund that separately and in addition to what they're already doing. And they would engage in soft skills and daily living skills while they're there with the White House.
So basically what we would do then is with all these agencies except White House, we would make them as needed contracts, not to exceed the total pool. For White House, we would just amend their contract to include the language that they also would be in this pool and able to draw for hourly respite in addition to their crisis respite. Sound right, Linda? Yeah.
Yeah.
Yeah. So that's what we're asking for. And then we'll advance this, to the county through my committee and get approval for new contracts with these two new agencies. And then we'll restructure the other contracts to change the language so that they're as needed. So that's what's being proposed. We need an approval from Warren County to do so. Any questions, discussion?
I just
What is Cassius?
Sorry.
What is Cassius play dates? Is that, I'm not even familiar with what that is.
Looked it up.
Cautious, Cautious Play Dates is a daycare type center that has trained individuals that and experienced staff that have, it's kind of like a drop-in center for daycare, but they're also willing, they also have flexibility as far as hours are concerned. They do have experience working with children with challenging behaviors. And what it would offer us and a lot of opportunity for flexibility is they can do on-site and off-site availability. And one of the nice pieces is that they're really close to Cooper Street, and some of the families there could benefit from childcare. And so this would kind of offer on-site support, as well as within the Cooper Street, we talked about using some of their common areas to do respite, either group or individually with some of the kids there to kind of do some supports for the individuals, families that are there. So it would definitely offer that, but it would be open to any child or family that's in this community. Usually they do a 3-hour block of daycare. So then even if we had parents that had special needs children, but they needed to go to their own doctor's appointment, they could drop off their child at Cautious Daycare and they would bill us while they went to take care of their doctor's appointment and then come back and pick up the child.
Okay, thank you.
Mm-hmm.
So you had a question too?
Yep, that sounds fabulous, by the way. Cautious play dates, that sounds great for the community. I was just wondering, of the recipients previously able to access the respite funding, had those funds been exhausted in previous budgets? So is there a chance here that someone that previously would have tapped into this now can't get it because it's spread thinner? Or was there money left over in previous budgets? So it's an opportunity for Big Brothers, Big Sisters and Cautious Play Dates to tap into that fund?
They've experienced some challenges from the revamping or the mental health reform. And when that system changed, Northern Rivers and captains, mainly Northern Rivers, struggled to maintain because their pool changed and how they looked at respite. So we had not been using fully their funding. We added in captains and they did well up until we had COVID. And then they've had some staffing shortages significantly. So we have not been able to exhaust any money. And actually to date, we have not, out of this $16,000 pool, we have not been able to spend any this year. So hopefully opening in that we can maximize and be able to use that funding. And so we would be able even to offer either more hours or more support to more families at this point.
Thank you, Linda.
Any other questions from Warren County? If there are no more questions, do I have anybody willing to make a motion to accept this proposal, this proposed change?
I'll make a motion.
So Belinda, second. All in favor, show of hands, please.
Aye.
This is an aye, okay. Thank you. Any opposed? Any abstentions? I don't know if any of you all work with any of those agencies. Okay. The motion carried for Warren County.
Don't even need me.
I just want to say that appears to be a great way to utilize the resources that we already have in our community. Really good outside of the box thinking. I don't know if that was your idea, Linda, but that's awesome. Really creative.
Thank you.
Yes, it was Linda's idea, so. Absolutely. Okay, so now we're going to move to our agency presentations. And originally we had planned to have Dean Klickner, as folks know, who's a director of our local Warren Washington Rose House on Montcalm Street. But I have heard today that maybe Dean was unable to join us. So Jolene Darby from People USA is with us. So welcome, Jolene.
Thank you. Much appreciated. Yes, and I'm sorry about the last minute change. Dean couldn't. I figured I would jump in, and then I did send some slides. They're quite extensive to be shared with the members of the committee, so you can review it after. So I'll do maybe a brief overview of Rose House, and then Rob, did you want me to talk a little bit about the peer forensic diversion model?
I'll go ahead, Becca.
Yes, if you could. And Linda Mashad, can you mute Linda? We're getting some background noise.
Sorry, I thought it was.
Yep, not a problem. Thank you.
Thanks. All right, so I'm Jolene. I'm the Chief Operating Officer at People USA. We operate the Rose House in Glens Falls. It is a 24/7 crisis diversion house that offers respite for 5 to 7 days currently for those in crisis. So right now we're only serving individuals over the age of 18 that are really trying to get support through peers connected to services and work on their whole health, but also avoid the hospital for psychiatric reasons. Also, we work very closely with the police to help assist someone they might find in crisis that maybe doesn't necessarily need to be inpatient, but really needs the support of a peer, a safe environment. If any of you haven't been to the Rose House, please reach out to us. We are starting to do tours again now that we're not in quarantine all the time. So more than happy to do that if anyone's interested in coming by. And the slides that you'll see are pictures from 4 of our Rose Houses that we have in different counties. We also provide services in Putnam, Orange, and Dutchess. And our Orange House also serves the county of Ulster. So our houses are staffed 24/7 with peers. Someone has their own bedroom. They have access to, laundry. They can have a clean kitchen to cook out of. They have staff there all the time to support them. They can come and go. It's not an environment where once you're here, you can't leave. Obviously, we do have COVID protocols in place, but we want people to be able to get the support they need while they're still in the community. So it's not a 5-day, you have to stay at the house the whole time. We also have a warm line that runs out of that house 24/7. So if someone necessarily doesn't feel like they need to come in for an overnight stay, but they do need that support, that phone is on 24/7. I do mention that it rolls over sometimes when the house gets a lot of calls to our other Rose Houses. Since COVID, we've really been trying to capture the increase in call volume. So sometimes they might not necessarily get an exact Warren and Washington staff, but they will get a staff at some point. In the past, we didn't operate that way, but with COVID, we wanted to make sure that we weren't missing any of the phone calls that were coming in high capacity. So a lot of the information I'm going to share with you in the slides after this meeting is very, very detailed about, what the Rose House offers, our menu of services, how to get connected. We don't need a referral for someone to come in, just so everyone knows. The person can call. It's a voluntary house to be able to come into. Voluntary to come in and voluntary to leave whenever someone wants, and they don't have to stay up to the whole 5 days. If they just need one night is okay. We don't ask for proof of a diagnosis. We really wait for someone to come in, and then we kind of talk to them about what it is that brought them to us and what's going on. We like to not create a lot of barriers for someone when they're in crisis and ask them 75 questions to get approval. So it's pretty easy to be able to be a guest at the Rose House. So that's a general overview. Again, the slides that I'm going to share with you, and I apologize, it was last minute I jumped on. We'll get more information. And does anyone have questions about the Rose House as of right now before I talk about a new project we're working on? No? Okay. So we are also working on implementing, hopefully in the very near future, a mobile peer forensic diversion model. It's a team of a social worker and a peer that will go out into the community and assist law enforcement, courts, in helping people find alternatives to incarceration. So we do have a model that runs similar to this in Westchester County, that meets police officers out in the community for those that have identified being in crisis. And we walk through the process of assisting them with getting resources, mental health, substance use, pretty much any type of service need that they need. And then a lot of times we actually go through the court process with them. So if that means going to court as a support or helping them get LinkedIn services to help avoid extended incarceration or higher charges, we do that. We really want to give people the opportunity to get the resources they need and get well again in the community and not in jail. So we are really trying to work and implement that program upstate with many of you. So once that gets going, we'll probably do a lot more outreach. And we will be hiring a licensed clinical social worker to oversee that program so that the team has that clinical support, but it will also be paired with a peer. It won't be 24/7 right now. We're going to use our Rose House as support as far as the warm line and stays. We're really trying to make sure that the team is operating throughout those hours that are the most need in the community. I have just gotten back after 2.5 months off of medical leave, so I'm getting caught up on all the new exciting stuff, but we are working on our work plan right now. So we're really excited for the opportunity to assist not just law enforcement, but all the other providers in the community as well. Any questions? All right, well.
Jolene, just a quick question. Will it be with all of the law enforcement agencies up here? Are there certain ones that you're starting with, or?
I think that they're going to be certain law enforcement agencies that will be specific. I believe Steve Michio, our CEO, and Mark Giuliano, who's very involved in CIT trainings in Westchester County, went up to you guys this week, and they're going to also be partnering to help assist with getting CIT trained officers and going through that process. So I believe, again, I just got back this week after being out for 2.5 months, but normally how it operates is there's different law enforcement agencies that are picked to participate, and then it kind of expands from there. So I know that we're there at the very beginning stages of that. But Mark Giuliano travels all around nationally as well, helping with CIT, and Steve sits on the board of international CIT training. So I think, that's going to be a really good dynamic between the team and then also the training for the police. So, I think we're all moving in the right direction there.
Jolene, could you just comment again on the staffing of the?
Yep. So there is going to be an LCSW that will oversee the clinical aspect of this team. There will be a full-time licensed social worker LMSW, and then there'll also be a full-time peer specialist on this team. And then there'll also be a very small admin support as far as helping channel referrals. We know that the police are interacting with people more than ever and need the support more than ever for people in the community. So we're hoping to make sure that whatever workflow we create, we get there very quickly as well when the time is in need. And strategically kind of plan that out based on geography, but also high call volume times when the team is needed.
So just as Jolene was mentioning, Steve Michio and Mark Giuliano were up here in Warren County this week doing a SIM remapping exercise on Monday. And the sequential intercept mapping SIM, is really takes a look at it's a model that has different intercept points where people come in contact with the criminal justice system. And this remapping was particularly focused on the early intercepts related to first contact with law enforcement, point of arrest, crisis intervention. And so this is really a precursor to our CIT trainings that Jolene mentioned. And that's part of the same grant that they received to do the SIM remapping and to do the mobile team that she's talking about. So all this is all part of the same grant. And we really look forward to working with your agency on developing the CIT trainings. we had really great buy-in at that meeting and great attendance at that remapping. And I'll talk about that a little bit later. And it's really the kickoff to the development of a local crisis coordination committee that I had mentioned earlier in the year. We had been hoping to pull together all of our crisis providers and have, you know, some periodic ongoing meetings. So I'll talk more about that later, but thank you very much, Jolene. And does anyone have any other questions for Jolene about People USA and Rose House or the new programs that she's mentioning?
All right. Well, thank you so much. I really appreciate it.
And,
Looking forward to it.
Just a comment too, People USA is in the process of becoming a health home care management provider. Do you want to mention about that, Jolene?
Yeah. So I didn't know if you wanted me to bring it up. So we are working on expanding our health home. About 2 years ago, right before COVID started, we had started working, doing health home for care coordination, partnering with the Institute of Family Health in Ulster County. And since then, we have been designated as a specialty organization to provide Health Home Plus services. So we have already expanded into Orange, Putnam, and Dutchess in Ulster. And then we were grateful enough to meet with AHI and other providers to talk about expanding those services that are really, really needed up in your area. So we're really hoping that a complement to the Rose House and this team would also be having access to a care coordinator long-term that would be able to provide Health Home or Health Home Plus services, and also be very, very engaged with people that are in the hospital and coming out, so that we're really hoping that those people stay engaged in those services. We'd be willing to go into the hospital and meet them where they're at, get them signed up for the services if they're interested. The model, obviously, it follows guidelines for health home services, but it's kind of like a no wrong door. Even if you can't bill for providing 1 million services a month, it runs very similar to the Rose House model, where you're going to continue to offer people support, and it's very intensive for the participant. And you know, we've been lucky enough to have numbers that have shown a lot of graduation rates. So it's not just serving the same individuals. We've seen them actually progress over 6 months to a year, so that we're able to accept more referrals. And we started off with a less than part-time. It was a part-time position, and I think we're now up to 6 health home coordinators in a matter of 6 months. So it's expanded very rapidly down here, and we're going through the contract process right now to be able to start working up there and then getting those referrals and coming to your housing meetings and care coordination meetings and kind of, you know, assisting in that way too.
Great. Any questions for Darlene or for Jolene on that particular service? No? Okay, well, we're pleased to hear it. And thank you, Jolene, for presentation today, stepping in. And we hope at some point we'll be back to in-person meetings, and some of the folks that haven't seen the Rose House can see the Rose House. We'll have plan a meeting there one of these upcoming times.
100%. Thank you so much.
Yep. All right. Now to move on the agenda here, Sue, you know, my thought from your comment last week was to set aside some time today. I maybe didn't describe it quite right on the agenda here, but I thought that having Linda here, having Jen Hill with us, and others, that we could speak to some of these issues. Do you want to kind of frame it again, Sue, for us the way you did at the last meeting?
Yeah, thank you so much, Rob. I'll take it from an EAP perspective. We are seeing a lot of family members of the businesses that we serve, and of course we cover the individual employee and the family. So we are seeing a lot of children, more than usual, coming through EAP. So children of our members, struggling to find a place in the community for treatment. We know many of our local providers are overrun because of the need in the community. I'm sure, you know, the schools, obviously, with events of the past couple of weeks, are struggling as well. And our whole world is mourning, of course, events. But then on top of that, we have the experience of people in our local hospital's emergency room, sometimes 5 or 6 days, which as someone who has worked in that environment, I feel that's a very toxic environment for a child to be held in. It further traumatizes not only the child, but also the family members or caregivers involved with that child. Children are not getting treatment, they're not getting education, you know, to keep them on track for when they return to school. Finding beds is a nightmare for the staff in that environment. And then we hear about our colleagues at Ellis, you know, closing, being in a position of hopefully temporarily closing that unit. So it leads me to think, just from what we're experiencing here, that our children and their families are in crisis in our community. And what does that then add to? It adds to the issue of addiction. It adds to the parents being depleted, and some of those parents are trying to work as well as balance their family life. And you know, those of us that have done that under relatively stable circumstances know how draining that can be. And so it seems like we're at a point in time where we should be having a conversation specifically about the mental health impact and the addiction impact for those children. I don't have the answer, but you know, it's a really, really big issue. And I think all of us are pretty brilliant on these calls, and maybe it's something that we as a community should be looking at, and particularly in terms of funding coming down. What, you know, I love this idea of Kasha's place, terrific, Linda. That certainly adds to the relief for families and children in our community. But what do we as a collective, what do we do about it? That's really where my thought was coming from.
No, I definitely agree that there are kids in the ERs for very lengthy periods of time, and the discharge from the ER is not necessarily discharge because they've been doing better. It's discharge from the ER because there's no other option. So that presents still them presenting back in the community with the same level of stressors, and it takes very little to kind of escalate them back up to a point where they're recycling back through the ER and substance. And Jason's also on the call, and we've been talking about, you know, just that whole substance use as well as the mental health and substance use, and kind of seeing kids even younger exploring and experimenting with substances. So that brings another component to all of these pieces, and kind of seeing where we can assess that. And I know that, you know, even with systems of care, we're talking about prevention and early intervention. So if we can get more supports in there as they're younger, would ultimately be the ideal piece to dealing with this, as well as, you know, so the prevention and intervention, but we can't forget the intervention. So I think we still need to kind of increase on the intervention. So hopefully under these extra dollars and the ad hoc, we might be able to identify some kind of additional supports, or look at some non-traditional community supports, and kind of being able to kind of engage kids. And so if there's something at the Y that's going on that we can engage kids more into, that's what I would think would be something that we wouldn't be just kind of giving them and they would leave when we leave, but it's something that they could sustain over time because it's already a community support.
I'm just going to say thank you for bringing this up. We talk about this all the time in our worlds. One word that just restorative justice practices in schools. We need that desperately, and we need trauma-informed practices in schools. And when I say schools, I even mean, you know, or like Head Start programs, any sort of, you know, cheerful cricket program or something like that. Those what we've seen, and we've gone in as YR Connects team, we've actually gone into BOCES for a day. And we've seen that our kids are starving for that sort of communication. The thing that community building brings to just one classroom in one day, it's very impressive to watch. I think that will help with the behavioral health crisis that we're going through. How do we get that across our communities into our districts? I'm not sure, because I've been pushing it for a long time. I think education and awareness are key for our community. I see a lot of different agencies, they have concerns, but they don't know where to start. And really, it's things like looking to programs that you normally wouldn't even think of, like Kasha's Playdates and Big Brothers and Big Sisters, that serve our families to see, to educate and to spread that word. And I don't, trauma-informed practices, that's something that I think people are just, even in our service organizations, are getting trained in. So to train entire school districts is quite a feat, particularly, if they're worried about, their education. But as we say, our kids can't learn if they're constantly in crisis. So those are some solutions. How we get to implementing those things, I don't know, but those are some really solid evidence-based solutions.
Definitely agree. And I think that, when you mentioned training, it's something that we have to continue to do. So, looking at that, it's like that continuous training. It's not a trauma-informed training and then it's a one and done kind of situation. It's kind of continuing because new staff come on, new incidents come on, and kind of needing to continue to put that in people's minds.
Yeah, that's a good point, Linda.
Sorry.
I was just going to comment that one thing we could do is when we put information out about the ARPA funds or even the opioid settlement funds that we'll be dealing with in a similar manner, we could highlight the need, the desire to see proposals related to children's services, children and family services. Yeah. I'm sorry, Amy, I jumped on ahead of you.
No, it's okay. I have so much in my head anyway. I needed a minute. Just going back to what Linda said about, the trauma-informed trainings and kind of, unfortunately, sometimes there's that one and done kind of a experience. And I think what we're seeing across the state is that for schools to be most effective, they need more than just the trauma training. They need coaching, they need collaboration. I think this speaks to Amy's point about just the different programs that exist in communities and how thinking outside the box, we can, start to address more of that prevention intervention side of the continuum, because the fact is, there's always going to be long wait lists. There's always going to be challenges getting kids services. So we need to kind of start earlier with the education, the prevention, the intervention. We need to build those community collaboratives that are working together to meet the kind of comprehensive needs that families have. And it's not just about the children, it's the families too. So that kind of two-pronged dyadic approach to supporting families and supporting students, so that when kids are in crisis, families they have the tools and the skills and the resources to be able to support their youth, and that people around them in the community have the tools that they need to support the families. Because I think we're always going to come up on these issues of services and just kind of gaps and access challenges. So just what I liked about the respite options is that it really is supporting the whole family when you can provide those kinds of resources. And I think that's how we have to look at this, not just children's services, but it's family services. How do we support the families?
I think that's such an important point, Amy, because in every family, there are children that somehow with great resilience and grit manage to survive and move forward. And we have something to learn from those children. And we should also be shoring them up within the family. So the whole unit, you're absolutely right.
Linda, do you have your hand up?
I just wanted to say that I think it's critical to think outside of the box. So finding out about Kasha's play, that was great. That's something completely different. And we got to try other stuff because the one and done stuff just doesn't work anymore. And it's just, we gotta move on and try new things. And I think that these kids need so much. Well, let's give them some fun also. If they have something that's fun, something to look forward to, they might not be at the hospital falling apart. They need outlets, and there aren't any. I mean, I don't know why we don't have the youth center at our meetings. I mean, do they come to any of the mental health meetings ever? Because the Glens Falls Youth Center, I mean, provides so many services to so many kids that are really needy, and they do great. They go back for everything. They don't want to leave the youth center because they feel included. It's a family. And, we need more things like that, I think. Mm-hmm. And I just hope that that's what we really look into, because I agree with you, Amy, the waiting list, that kind of stuff, it's ad nauseum, it's not going to change. That's the new norm. And we got to come up with better stuff that's, I don't know, more creative, really. That's it, folks. I'm stop talking.
I think I saw, that's one thing that we were pointing out in the Sims training, like prevention, for youth. And I saw Amanda West on here at some point, and I know that the Council for Prevention is really got, a lot of the mental health prevention in the schools, but they probably, could use 20 more workers just to do, the programming that they're doing in the schools. So I just, kudos to them for, keep on doing that. And I did want to comment on the youth center. I think the youth center also could probably use 20 more workers to be able to come to meetings and to be more collaborative with different agencies, because we have reached out to them in our YER Connects. A couple of times we met with them to see if they wanted to do restorative justice in the youth center for free. And they just weren't able to accommodate that. And we also reached out to the Y, but those are the partners that we need. And I know the Y is, kind of reestablishing themselves, but that, those are where we need to be too. And we know, I mean, most of our organizations know that it's just a matter of getting there.
Thanks, Amy. It's Amanda. I was going to pipe in. I will say we are having schools cry out to us. We need to continue evidence-based programming. We had 2 calls today. Everyone wants it and they want it now. And we are 10 full-time staff, 2 part-time, and spread thin, covering 2 counties. So when we look at the bigger picture, when we have one educator in Johnsburg doing a full evidence-based prevention program, that's putting them there for weeks. Or we'll have another educator in Cambridge doing a full evidence-based program, putting them there for weeks. So we're spread so thin, and we try to think outside the box, and we're trying to accommodate as best we can as everyone on this screen is. One of the things that we are starting to do now is implement the Teen Intervene, which is an expert model. And we were asked by one of our larger school districts to have someone 1 day a week during the entire school year, just solely the school is going to hold space for this person to do Teen Intervene. And 1 day a week, she will be there, meeting with parents, meeting with the, child study team, and really getting to know these youth and working them through their triggers and getting them to understand addiction. But that's just one person in one school. So if we could clone everyone, it would be great. But, like you all, we're definitely open to suggestions and really trying to, spread our wings and help as many as we can.
Question, Amanda. When this when the schools are calling, they have access to funds to contract with you for additional services or no?
Yeah, that's not even been, it hasn't been an issue so far, probably mainly because of the BOCES COSER. But we had a district reach out to us today saying they want teen mental health first aid in the fall. So a lot of mental health first aid trainings, a lot of continuing on, a lot of adding on. One district was like, I don't know what to do with my 5th, 6th, and 7th graders. And we're like, you have evidence-based programming in all of the elementary schools. And then they get to 5th grade, they've already had the foundation and the fundamentals. Now they don't have anything until 9th grade. There's a huge gap. So really trying to work with, individual districts and, try and help as best we can. But it's frustrating because we also have the calls on a, tri-weekly basis of parents whose kids are in crisis and they're not getting anywhere with anyone in the community. So it's hard. You all know.
And I think equally challenging is not only the younger population, as we've got our 17, 18, 19-year-olds that are really struggling too. And I know Weight House has picked up a big chunk of support for them. But it's kind of the same thing. They're sitting in the ER, but then they go to behavioral health and they come home. And then we have a couple that are still sitting in behavioral health because there aren't many options. So it's just kind of it's across the gamut of that young population. So we can think of any kind of creative things. Teen Intervene is a great intervention, and Why Try is another one. And there's a couple other, ones that we can, if we can get the funding and get resources for Amanda's team, that would be wonderful, and expand her team.
And the Recovery Center.
And the Challenge Program. Yeah, there's a bunch.
Yeah.
But those are, I think, what we see is the more interactive ones, the restorative justice ones that our youth are tending to kind of migrate towards, as opposed to the regular talk therapies at this point.
Yeah, I know one of the things that we're trying to do is develop more groups, especially over the summer, because we know that our engagement with our school-based clinicians drops off radically. Hopefully being able to offer groups will keep the kids engaged. Then we just have to tackle the transportation barrier. Nothing like additional challenges. But I mean, even trying to get some of our clinicians to run groups throughout the year, we've had really good response to anger management groups for kids in the past. So looking at any creative option that we can do to implement something at the clinic, because I know the waiting list is long and we're trying to do everything that we can, but it's time to get really creative. I know the kids side is desperate. I haven't seen as much with the kids, but I know specifically for some of the adults that we're seeing, they're getting 2 or 3 days in the hospital and coming out just as ill as when they went in. So I can't imagine that the kids are getting much more, knowing that there's beds and beds full of kids waiting to get in.
Is there a centralized list of which services are available in which local schools? Because sometimes when we talk to parents, the parents are not aware of what's available in school systems. Like if one school had BHSN and Council for Prevention, is there a centralized list for that so we could use it as a resource?
I mean, I don't have a centralized list, but I can certainly provide a list of the schools that we're in and like what days that we're there. And hopefully other agencies could as well, so that somebody could compile it.
Yeah, I mean, I'd be willing to compile it. I know I have some of the information, but I would want to make sure that it was the most up to date. I know that we tried to do that with Warren County did a provider fair, and part of that data collection is to kind of gain that. And so maybe we can kind of look and see how we can use that to be most efficient, and continuing to even update our directory book that the Council for Prevention puts out, and kind of working together to kind of master that. And I know Washington County is doing a fair coming up. I think it was postponed, I heard, and it's scheduled for September.
Yeah, the end of September.
We can certainly give a list of what, services we are offering. We're coming up on our prevention work, OASIS work plan runs July 1 to June 30th. So we are actually coming up on it will be historically our biggest work plan year yet. So, I mean, we can certainly, it's exciting. It's daunting. It gives me heart palpitations looking at it, but, I can certainly provide that.
And I'm wondering even if there's a way that we can even support Amy's group with the Y Reconnect, and as far as they have the Google Meets, and somehow we can expand the Google Meet, or not Google Meets, Google Maps documentation that are on the, and Amy could speak probably clearer to that than I am, but it's that resource of being able to look and see what services are where and getting the information. I don't know if there's a way we could expand that, Amy.
Yeah, so we're always adding stuff to the Google Maps, and we just got an intern this week, so she will be plugging in a lot of new addresses and services and making sure it's updated over the summer. Anybody is welcome to look at that and look at explore the possibilities. I just heard of some new children's organizations that I'm going to reach out to as well. Just to see, learn a little bit more about what they're providing, and also see if we can bring them into the probation loop and the YR Connects loop to utilize the service, as effectively as possible. But yeah, I mean, anybody can look at that map and determine, what services we have, and what it usually links right to their website. If we do they have a website, so you can look right on their website and see what they're doing, what they offer. I just feel like preventive wise, there's just so much more we could be doing, but as far as resources and I guess organizing that and making sure that there's funding for that. And we also don't want to duplicate services. We don't want to duplicate something that's already being done. We want to make sure we're providing, the agencies that are here with what they need to do the work. And it's hard, but we definitely need more. There's no doubt about it.
I don't know what this looks like necessarily, but schools are required to have and help me out, Linda, if you remember the name of this, but it's basically a liaison or a designee to help connect families to specifically substance use, misuse services in the community. And I, just kind of in the spirit of thinking about collaboration and how important it is for families to be building relationships with schools when they have concerns about their students. I'm just wondering if there's some way to loop in who that designee is for each of the school districts so that they are aware of all the services, and that we kind of collectively in the community are always encouraging families to reach out to that designee, so that there is that ongoing communication between school and home of these are our concerns this is my concern for my child. These are the resources we need. Can you help me? And I know there's certainly times when families will be very reticent to do that. They don't necessarily want the school to know what's going on, and that's fine. There's certainly room, to access services in other ways, but knowing how important that collaboration is and building trust between school and home, I think just not to forget that there is a designee, at least for that purpose, for connecting students and families with services related to substance use, misuse. It's some kind of designee. The name of it is escaping me.
Yeah, under the McKinney-Vento, they kind of have that liaison person that kind of connects, and that's kind of all aspects from homelessness to substance use to mental health awareness kind of piece. So that's one of the liaisons. I know that different schools have different people, and that's piece, but kind of like what you're saying in the school base. I know that there's also that initiative, and Amy's also aware of it, and a couple others, is community schools, and really looking at, when we talk about all of our communities, that within each school district, they have their own little unique culture sometimes, and and supports, and how schools are kind of sometimes that center base, and looking at resources and how even our supports can be funneled through the schools to kind of be able to be more accessible to families, and also build that trust and relationship between a school that's positive as opposed to negative or punitive or threatening in some way. And so I know that there's been lots of work done downstate with community schools, and being able to filter that in as well. Even natural supports within a school, and having those liaisons and from school-based and community-based working together. And Diane Hammond said that, if we talked about licensing within schools, she would definitely be from OMH willing to kind of support and help. She sent me an email about that.
Carrie, do you want to, I was just thinking about our planning process and everything, and how we can incorporate some of these comments in our planning process, but I see you posted something else. Do you want to comment about the CHAMPS?
CHAMP is the ombudsman program. I think HI has that, so that's a 1-800 number, but it's available for us locally to help with substance use issues. I don't think it's necessarily just for adults, so that may be part of where they're linking people to, or that liaison program. So I believe that's still through AHI. And yeah, we're still waiting. I haven't heard much from the conference. I think they're coming up with their own surveys now. The process, we haven't even received guidance yet for the planning process. I also have drafted a survey through Google Docs that I can't imagine it would hurt to send out locally to our providers and our subcommittees, just to get feedback anyway, even if the conference comes up with their own surveys. So it's just been a really kind of an odd process each year. Since COVID, it's gotten pushed out a little more, but now it's just really vague, and I'm not sure when that will happen. So we'll certainly keep you updated. I have sent the survey, I think, to Linda and a few people to take a look at, or what I've developed so far, but if you guys are willing to participate, we'd love to get that feedback, at least locally. Sometimes the statewide surveys or the conference surveys, you've seen one county, like they say, you've seen one county. So sometimes those more generalized surveys don't always capture what we need to be asking locally, if that makes sense.
Just seems like some of the comments and ideas could be incorporated in our local plan, and develop some, practical steps to try to
objectives to meet the goals. Yeah.
To accomplish some of these ideas that are being generated. So
yeah, especially with the funding, if we're getting the ARPA funding to create additional programming and resources.
We just had our Washington County Systems of Care meeting too today, and that kind of ties into what Carrie's saying, as far as like, where do we start? What do we want kind of outcomes to be, and as well as where are those needs for change within the community, and how do we get there? And looking at resources, and we talked about even like surveying agencies with like a trauma assessment of where their agency is with being trauma informed, and how do we kind of do that. So there have definitely been lots of discussions, I think, on multiple levels. I think if we can pull them all together, and kind of be really great.
okay. Any other thoughts or comments on this? And Sue, I don't know if you have any ideas about what we, beyond this sort of brief opportunity for discussion, do we want to keep revisiting this a bit? Do we want to establish some other forum to advance some of these ideas, or any thoughts?
Well, thank you for allowing this time. And I do think with the ARPA funds, but also with the opioid settlements, as you said, I think we're on the brink of a lot of opportunity. So being able to really think creatively in our community could be very powerful. right now, and I think it's worthwhile having further conversation about it, both within subcommittees and looking at little pockets around the community and ways in which we can make it better for both counties, because we're, you know, often this comes down to the financial piece, but we might have an opportunity here to do something pretty cool and impactful, you know. I guess that's what I'll say about that.
Absolutely, absolutely. Well, thank you for bringing forward the issue and the request to set aside some time like this. I think it's very productive. Any last comments before we move on the agenda? Okay, hearing none, then I just will go over the few informational items that are listed on the agenda. I had listed here, just wanted folks to continue to think about the return to in-person meetings. I know we're still meeting via Zoom at this point, but I think, you know, toward the fall, we want to look at probably reconvening in person. Probably initially we'll go back and forth between Warren and Washington counties at the municipal centers. And that's usually where we can find large enough space that people still feel comfortable that you can somewhat distance and that sort of thing. The conference room here is pretty tight when we get everybody here, including our guests and that sort of thing. So more information to come on that. Our Community Services Board Budget Review Committee has established its meeting dates this year. On June 28th, Tuesday, June 28th, from 1 to 3 p.m. and Thursday, July 7th, 10 to noon. So we'll be convening the Budget Review Committee, meeting with our agencies, going over the 2023 agency budgets. Then also I just had listed here to mention the SIM mapping exercise that we talked about earlier. And I just wanted to comment about what a good representation and participation we had, a broad participation across the crisis system. And really like to thank, is Carrie still on? I can't tell if Carrie's still on, but Carrie did a great job. Thank you, Carrie, for really organizing that and making many of the arrangements for that. We had all of our crisis providers. We had good representation from law enforcement, our local law enforcement agencies. We had EMS present. We had the peer representation there, the Rose House. Really good engagement just all across the system, and great buy-in for the concept of continuing to meet and to have a local crisis coordination committee. So there's other partners we want to keep drawing in and bringing folks in to that conversation, but everyone seemed very excited about it. So, and I think it is a good precursor to our CIT trainings that we'll be doing. I think in the past we did some CIT trainings and it was viewed maybe a little bit too much solely as a training for law enforcement rather than really the creation of crisis intervention teams where you have trained law enforcement, but you also have, you know, the community partners that really constitute to make it up as a team and a team approach. And so we're advancing some discussions there, talking about a lot of crisis issues. We'll be talking about the coming of 988, which is coming in July. We'll be talking about ideas like 911 diversion. Wouldn't it be nice if when you're in a crisis and you call 911 or 988, you get to a mental health professional who does a triage, you know, and maybe it doesn't even involve law enforcement. So there's a lot of ideas and things that we hope to advance through that group. And I don't know, Carrie, anything else you want to say about that day, Monday?
No, it was just really well attended. I think it went well and it just allowed for a lot of, you know, critical discussion and a review of some of the opportunities we have to expand. And it was just really good to revisit. It's been almost 5 years somehow since this didn't happen. So I appreciate everyone that was able to attend.
thanks again for your help with organizing that. And then the American Rescue ARPA funds, we've already talked about that. I just sort of kept that as a standing agenda item, so I don't think there's anything more to cover on it today. The opioid settlement funds, I would hope, but maybe we would even end up using that same ad hoc committee to solicit proposals for the opioid settlement funds. I'll get a table together, try to get it out for the next meeting so that we could have some further discussion on the opioid funds. But it seems like since there's some overlap possibly between what agencies might be proposing, it might make sense that we're looking at both pots of funding to see which one's most appropriate for which project. So just something to keep in mind. And then I think that is all I had on my notes. Did anyone have anything else before we close the meeting?
Rob, you skipped the change of the date for next month.
Thank you. Thank you for that. That's very important. I don't know how I missed that. I did want to ask if we could rearrange the July meeting date. I did not realize when we put the schedule together that I was scheduled to be out of town on the 14th of July, which is our regularly scheduled meeting next month. So I'd like to propose if we could change that meeting to the following week, would be July 21st. We don't have a meeting in August, so we would not meet again then till after that in September. So I'm proposing to push it out a week.
I'm good with that, Rob. I don't know if everybody else has any kind of thoughts about pushing it off a week.
Don't see any problem with it or issue.
Any opposition?
I'm good.
Okay, not hearing any opposition. Do we need to vote on that, or can we just go ahead and move it?
I think we would just by consensus, we'll just reschedule that meeting. Hearing no objection, right?
Yes.
I realize people may not all be able to make it, but they may not have been able to make the regular meeting anyway, so, yeah. Okay.
Anybody else have any other items that they'd like to bring up at this time before we close the meeting? Not hearing anything, then we declare the meeting closed. Thank you guys, and we'll see you in July.
Thanks, everyone.
Thank you, everyone.
Thank you.